The rescue and recovery workers who toiled at Ground Zero in the months following 9/11 and then got cancer have waited years for the government to take care of them. Firefighters like Jeff Stroline, now retired on disability.
Do you feel the cancer that you developed started down there?
Oh yeah, there's no question about that. I don't, I can't see how they were saying the air's safe.
Stroline worked at Ground Zero for several weeks after the attacks. A decade later, he was diagnosed with lymphoma.
It's awesome, it's long overdue. There's no question about it.
The recommendation that 50 types of cancers be covered is the latest step in a decade-long struggle for Ground Zero workers to get the government to agree their illnesses were caused by toxins there. It took an act of Congress just to get respiratory diseases covered, as well as laryngitis, back pain, even carpal tunnel syndrome, but not cancer. Margaret Stroline is Jeff's wife.
Until it happened to me and my husband, I didn't realize it wasn't covered. And most people don't realize that cancers weren't covered. It just seems like it should be.
The recommendation is partly based on a soon-to-be-released study of 20,000 Ground Zero workers conducted by Dr. Philip Landrigan. What will your report tell us?
Our report will show that overall, the WTC responders have about a 15% increase in the number of cancers, as would be expected for a population of this age and demographic makeup in the United States.
Researchers found excess numbers of blood cancers like multiple myeloma. The Strolines are fortunate. They have good insurance, and Jeff is responding to treatment. But they don't want luck to be the difference in the quality of care any sick Ground Zero worker receives.
Anyone who was down there who have come up with any of these illnesses should have seamless health care and not worry about co-pays, who takes their insurance, or what kind of care they're going to receive.
Dr. Landrigan expects the numbers to rise. Typically, occupational cancers peak roughly 20 years after exposure. Scott, it's still less than 11 years since 9/11.
And Jim, we understand the new rule could take effect in as little as 30 days. Thanks very much.